Hello everyone and welcome to Module 5. This is your last full week. So what that means is that we'll work, our normal Monday through Sunday, talking about our topic this week, which is urinary and reproductive systems. So we're going to be looking at chapters 11, 12, and 13. So let's get into those. So we're going to start off with Chapter 11, and Chapter 11 is reviewing the urinary system. Now, the urinary system does consist of 2 kidneys, 2 ureters, a urinary bladder, and the urethra. The primary function of the urinary system is to regulate the extracellular fluid of the body, which is done through the formation of urine. The kidneys, however, carry out the major work of the urinary system. Urine passes out of the kidney through the ureters into the urinary bladder, and then it gets stored in the bladder until it's excreted from the body through that urethra. Now, the urinary system is broken into either macroscopic or microscopic structures. So I'm going to take just a few minutes and talk about the 2 differences there. We're going to start with macroscopic structures. So the first macroscopic structure, and if you break that terminology down, macro means large. So these are ones that we can actually see without the use of a microscope. So the first one is your kidneys. They are about the size of each one of your fists, so everyone's are a little bit different. And they are shaped like a bean, so that is actually where we get that kind of like terminology, the kidney bean. That's where that comes from. They're located in the retroperitoneal cavity, so if you want to figure out what that means, it is the back lower cavity. So what I always explain is if you have like the angry parent stance, whether that's mom or dad, and you put your hands on your hips, where your hands kind of grab on the back side, that is where your kidneys are located. The second macroscopic structure is the ureter or ureters. Each one of these is about 10 to 12 inches in length. However, they are really only about maybe a little bit larger than a pencil width wide. So they're very small in size, but quite long in structure. Their whole job is to work with the autonomic nervous system and carry urine from the kidney to the bladder. Now I say autonomic because we do not control that. It happens automatically. And it's not that we can feel the urine actually being carried, but it does happen every 10 to 15 seconds. The next macroscopic structure is the urinary bladder. The urinary bladder is a hollow organ, and it is located in the anterior pelvic cavity, so front lower cavity. Its whole job is to hold urine before it's been expelled, and your bladder can hold up to 500 milliliters of urine. However, you'll feel the need to actually void or go to the bathroom at about 250 to 300 milliliters. So when it's about halfway full, that's when you're going to feel it. And the final macroscopic structure is the urethra. Now, the urethra for male and female patients is different sizes, and that is based upon the structure of the urinary and reproductive organs. So for women, the urethra is typically about 1.5 to 2 inches long, and that is just because that area between the bladder and the urinary opening, or what we call the urinary meatus, is very short. We don't have appendages that are going to get in the way. We just have that cervix. So that is all that you have to travel, is that small amount of space. Males, on the other hand, are anywhere from 4 to 6 inches in length, just because, again, the area between where the bladder is and the urinary meatus, they actually have that secondary appendage, the penis, that is in the way, and that is where that has to travel through. The whole job of the urethra is to take the newly formed urine that was made and that is being housed in the bladder and just expel it out of the body. Next, we're going to talk about the microscopic structures. Now, microscopic structures mean that we have to see these with a microscope. We cannot see them with the naked eye. So when it comes to the urinary system, the microscopic structure is what we call the nephron. Each nephron, because each kidney has multiple nephrons, roughly about 1 million nephrons in each kidney, so very, very tiny structures. The nephron actually has 3 very important roles, and its functional unit, it is the functional unit of your kidney. One of the things that it is responsible for is maintaining homeostasis by continually adjusting the contents of the blood plasma. But it also does things like filtration. So filtration occurs in the renal capsule. After filtration, we have reabsorption. So after the blood and the water are filtered, most of the water and some of the electrolytes and amino acids are returned to the peritubular capillaries, and they re-enter the circulating blood. And after that reabsorption happens, we have secretion. And this is the final stage where urine is actually formed. It then goes into the ureters, ureters to the bladder, bladder to the urethra, urethra to the urinary meatus. Some of the word parts that you will see in reference to the urinary system are cysto or cysti, so that means bladder. Litho means stone or calci. Nephro is pertaining to the kidney. Reno also means kidney, so please be careful with that. Oligo means scanty, so we're talking about urine there. Meto is talking about the opening or the meatus. The suffix urea means urine. Uric or urico is referring to uric acid. Urine is referring to urine or the urinary system. Uro is referring to urine or the urinary system. And then vesico is pertaining to the bladder. Now, in addition, this chapter does discuss the pathology of the urinary system. It also includes discussions on things like paleonephritis, glomerular nephritis, nephrolysis, and acute tubular necrosis. So I would highly recommend going through and reading on those diseases, specifically for that of things like your course project, and knowing the terms a little bit better. This chapter also discusses the medications that are used for treatment in relation to the urinary system. Next, we have chapter 12, which is referring to the female reproductive system. The female reproductive system is designed to produce and transport ova, or the female sex cells, discharge ova from the body if the fertilization does not occur, and then nourish and provide a place for a developing fetus throughout pregnancy if fertilization does occur. The female reproductive system also produces the female sex hormones of estrogen and progesterone, which play an important role in the reproductive system. These hormones are responsible for the development of secondary sex characteristics such as the breast development and the regulation of the menstrual cycle. And while there are many, many females in the world, and we have many, many different OBGYNs, which is a obstetric and gynecology doctor, the truth is that with the female reproductive system, there's still so much that is just completely unknown. So even though I'm going to give you the hot topics, I'm going to guess is a way to say that, there's still so much that is so unknown about the female reproductive system. Now, the female reproductive system does have both internal and external organs. External is what we can see with our naked eye. Internal we cannot see with our naked eye. So the internal organs consist of, sorry, my slides are not working. There we go. They consist of the ovaries. The ovaries are almond-shaped glands, and they are located on each side of the uterus. The ovaries contain thousands of ova or eggs. And the truth is that women are born with the amount of eggs that they will ever have in their lifetime. We do not make more throughout our life like men. Men can continually produce sperm. Women cannot. We have all of the eggs that we have, we are born with, and there is no more that we can make. The next is your fallopian tubes. Fallopian tubes are what actually extend from the uterus, and they surround the ovary. They do not actually attach to the ovary, so it's almost kind of like they're kind of keeping their hand around it, but they're not actually touching it. Their whole job is to help move the ovum or egg from the ovary to the uterus to be fertilized. The uterus is next. This is a muscular hollow organ, and it is shaped like an inverted pear. It's located in the pelvic area between the bladder and the rectum, and the uterus consists of three parts: the fundus, or the upper part, the body, or the middle part, and the cervix, or the lower part. And the final internal organ is going to be the vagina. The vagina is a muscular tube that extends from the cervix to the exterior of the body. On the opposite side, we have our external organs. And the external organs are made up of something we call the vulva. And the vulva is actually a combination of 5 different organs: the labia minora, the labia majora, the clitoris, the Bartholin's glands, and the mons pubis. But along with these, we also have the external structure of the breasts. The breasts are found within the chest, and they are composed of mammary glands. And while they're found in both sexes, they only function in the female reproductive system. The breasts are not directly related or involved in the reproductive system. However, they become important after the delivery of a baby. Their role is to secrete milk for nourishment of a newborn child through a process we call lactation. The menstrual cycle is something that is specific to the female reproductive system. It consists of a series of phases during which the uterine endometrium changes as it responds to the changing level of hormones. The typical duration of a menstrual cycle is 28 to 35 days. The term that is used for the initial menstrual period is called a menarche. This is typically going to happen around a puberty age, which is around 12. Now, for each person, the cycle can start at different times. It all depends on a few things. It depends on 1, family history, and then 2, the sexual orientation of the person and how often or if they do become sexually active. Children nowadays are starting to explore things more at a younger age, and so that can actually kick in a menstrual cycle as well. Now, the other part of a menstrual cycle as women become older is that they start to track this so that way they can get ready for pregnancy. So during pregnancy, the uterus will change in size, shape, and consistency. The average pregnancy or gestation lasts approximately 9 months or 40 weeks and is broken into 3 trimesters. Each trimester is 3 months at a time, and up to the 3rd month of pregnancy, the product of conception is called an embryo. From the 3rd month to the time of birth, we then call the unborn child a fetus. Once you reach term or 40 weeks with a pregnancy, a woman will go through labor and childbirth. Labor is the process by which the fetus is expelled from the uterus, and labor occurs in 3 stages. Stage 1 is the dilation stage. This begins with the uterine contractions and terminates when there is a complete dilation of the cervix, which is 10 centimeters. The second stage is called expulsion. This is the time from the complete cervical dilation to the baby being born or birthed. And then the third stage is called the placenta stage. And I apologize, that is in a weird spot, so I'm going to add that up there one more time. The placenta stage. This begins shortly after childbirth when the uterine contractions discharge the placenta from the uterus. Now, after a woman reaches an age where she is no longer having children, she goes into something we call menopause. So menopause is the cessation of the ovarian activity and the stopping of hormone production. This typically happens around age 50, but again, that can change with the person. It typically, again, is going to list off of things based on family history, or any other sort of conditions that could hinder that. So if a woman has a hysterectomy early in life, that can do it. If there are certain medications, that can stop that as well. Menopause is usually diagnosed with the term amenorrhea, which is the absence of a menses for at least 1 year. And menopause usually comes with symptoms such as hot flashes, vaginal drying, and thinning. And again, this is all due to the fact that your estrogen level is falling. Some terms that you're going to hear within the female reproductive system, we have amino, which is pertaining to membranous fetal sac, servo or cervix, colpo, which is referring to the pubic region, crypto means hidden, episo is pertaining to the pubic region, galacto is milk, histro is pertaining to the womb or the uterus. I had a brain fart there. Lacti or lacto is milk. Mammo is referring to the breast as well as masto. Meno is menstruation. Metro is pertaining to conditions of the uterus. Oo is referring to an egg or a woman's egg or an ovum. Ufo is also referring to the female reproductive system, specifically that of the ovary. Overo is ovaries. Ovo, ovi, or ove, all pertaining to eggs or ovum. Salpingo is referring to your fallopian tubes. Utero is referring to the uterus or the womb, and then vagine is referring to the vagina. Now this chapter again does go on to discuss the pathology associated with the female reproductive system. This will include the topic of gynecology and obstetrics, menstrual disorders, endometriosis, PID or pelvic inflammatory disease, vaginal infections, and vaginitis. It will also talk about the topics of breast cancer and cervical cancer, as well as some medical, surgical, and diagnostic procedures. So I highly recommend, again, reading the full chapter. And we're going to round out this course announcement with chapter 13, which is talking about the male reproductive system. Now, the male reproductive system produces, maintains, and transports sperm, which is the sex cell for males required for fertilization. It's also responsible for the development of secondary male sex characteristics. When we talk about the male reproductive system, the structure and organs consist of 2 things. Consists of 2 testes and then the external sac called the scrotum. The testes produce hormones, testosterone. This enables the development of secondary sex characteristics, and it also plays a role in the libido for males. Within the testes, there are numerous tubes that we call the seminiferous tubes, which produce the sperm. Sperm is the male gamete, which is essentially the male sex cell, so much like the ovum is for females. We also, within the testes, you have the epididymis. This lies over the superior or top surface of each testis and stores the sperm after it leaves the seminiferous tubules. This is the first duct that sperm will pass through after it is produced. If you were to trace the duct upward from the epididymis, this would form what we call the vas deferens. This is a narrow tube that passes through the inguinal canal into the abdominal cavity. The vas deferens extends over the top and down the posterior surface of the bladder and joins the seminal vesicle. This union forms the ejaculatory duct. From the ejaculatory duct, it passes at an angle through the prostate gland. The prostate gland is a triple-lobed organ fused to the base of the bladder. It secretes a thin alkaline substance that accounts for 30% of seminal fluid. This will help to protect the sperm from the acidic environment of the male urethra and the female vagina. The urethra will expel the semen from the body during ejaculation, but it also acts as a way to expel urine from the body. So during ejaculation, the sphincter at the base of the bladder will close. So this means it will stop the urine from being expelled with the semen, but it will also prevent semen from entering the bladder. And then some of the terminology that you're going to hear with the male reproductive system, we have balano, which refers to the glans penis or glans clitoris. Gano, which is the seed, semen, but also means reproductive. Inguino means groin. Orco, orchaio, or orchid means testy. Phallo is phallus. Sperma or spermato means semen or spermatoza. Vaso is the vas deferens. The suffix spasidas means slit or opening. And then vesicle is the seminal vesicle. Now, this chapter will also discuss the pathology related to the male reproductive system. This will include things like STIs or sexually transmitted infections, BPH or benign prostate hyperplasia, prostate cancer, testicular cancer, as well as some other diseases and conditions. So as always, please make sure you are reading through that. All right, and here are the due dates for assignments this week. You have your discussion board, your dictation assignment, your course project, your quiz, and your live classroom. So make sure that you are getting all of these in by their specific due dates. If you have any questions, please reach out to me. Otherwise, have a great final full week for this quarter. Bye, guys.